Okay, so here I'm going to talk about bacteria infections of the blood that are spread through animals. And so humans are not the target for these, but we can be an incidental target. So one of the most infectious disease known is going to be the plague bacteria. This is Yarcinia pestis. And Yarcinia pestis is going to be transmitted to humans via fleas. And so this is going to be spread from rats primarily. And so this is a very explosive bacteria infection. It's going to spread from your lymph nodes to the blood, and there it can spread to the lungs, and you have pneumonic plague. The bacteria can replicate very rapidly in your lymph nodes and also produce a bubo and cause a bubonic plague. And from the bubo, the bacteria will spread rapidly into the blood and you can get pneumonic plague. And so Yersinia pestis is a gram-negative bacteria. It is a facultative anaerobe. It is a coccobacillus. There have been several pandemics associated with Yersinia, and today most of the cases are going to be from sub-Saharan Africa and Madagascar. And so this is an example of a bubo. Now, this is, again, very contagious, very highly aggressive, and in the second pandemic, which was known as Black Death, 1/3 of Europe's population was killed by Yersinia. Now, another is going to be transmitted to humans from wild animals, and this is Francia tularis, and this is we're going to call tularemia. This is going to be highly infectious again, and it is one of the most infectious bacterium. Key is that infected animals, you might not know that they have any infection, so this is not like a rabid animal that shows signs of rabies. If a person does become infected with this and it gets into the lungs, it can be lethal if it's not treated. Now, this is also a gram-negative coccobacillus. It's not a facultative anaerobe. This one does require air, and so that's why it prefers lung tissue. It takes up to 10 days for incubation, and typically you get in contact or you get exposed to this through contaminated meat. So again, this is wild animals, so hunters, people who eat meat from animals in the wild would be potentially exposed to this. You could also handle infected animals, so these would be veterinarians or wildlife animal care persons. This can be through an aerosol, and there are also the deer fly or a tick that can transmit this. This organism must be handled in a biosafety level 3 mechanism. Now, for the United States, there's about 100 to 200 cases a year. You're going to have potential skin exposure, and you're going to get an ulcer, in the glandular ulcer. And this is going to be at the point of contact with the infected animal or where the vector bit you. You're going to start to have swollen lymph nodes near the skin ulcer, so your draining lymph nodes will start to get swollen. And then you're going to get headaches, fevers, and chills. Pneumonic is going to occur when you inhale the bacteria, and this is going to lead to a dry cough, high fever, and chest pain, and can lead to death if not treated. The ocular glandular, which is the eye infection, is due to an eye exposure, and this can lead to, of course, irritation, pain, swelling, discharge, swollen glands behind the ear, and you can be very sore on the inside of the eyelid. Now, an oropharyngeal tularemia is going to be caused by ingestion, so ingestion of contaminated meat, for example, and this will lead to ulcers in the mouth, a swollen lymph node in the neck, which is shown here, tonsillitis, vomiting, and diarrhea. And then there's also a typhoidal tularemia, which is systemic. It gains access to the blood, and this is where you'll have high fever, fatigue, diarrhea, and vomiting. Now, the risk factors, again, are people who are going to be in contact with wild animals, veterinarian, park rangers, hunters, etc. Or people who live in forested areas, people who work with animal carcasses, landscaping, gardening in those areas where they might get in contact with where wild animals went through. The diagnosis is going to be a skin biopsy of a lesion if you happen to be infected by the vector or through the skin. You can do a bone marrow biopsy, fluid test antibodies. There are treatments. Streptomycin, gentamicin can treat this. However, it has to be treated especially if you get a lung infection. The fatality rate, if it's in the lung, is 30%. The ulcer fatality rate is about 5%. Now, another zoonotic type of infection is brucellosis. This is Brucella. It's going to enter our bodies when we come in contact with the pathogen, if there's a break in our skin, or inhalation, or drinking unpasteurized dairy products. So this is a zoonotic infection, and it can also infect the reproductive tract. Transmission is going to be primarily through occupational contact with infected animals or ingesting contaminated animal products. So that's why it's very important to have pasteurized dairy products. Chronic illness in humans can last for weeks or months. You can also have a cyclic pattern of symptoms. This is an undulant fever. And so these bacteria, for example, you have a fever during the night and then you're fine during the day. And then the next night you have a fever and then you're fine during the day. Now, this bacteria can be transmitted through cattle, swine, dogs, goats, sheep. It can be transmitted through unpasteurized milk when you slaughter animals, if you're a vet and you're caring for sick animals, laboratory accidents when you're trying to diagnose somebody and you get the sample sent to the laboratory and they try to culture it and they get exposed to it as well.